Hello everyone. From today onwards, we will start a series of questions that is 100 must know one-liners for Neetpg as well as Fmge. We will discuss 100 must know one-liners for every subject. We will start from today. The first is PSM. In part 1, we will discuss 50 one-liners and in part 2, we will also discuss 50 one-liners. In this series, I will only read question and their answer. I will not go in deep with the topic because it will be time consuming. We have to cover as much as questions in the limited time, so it will be helpful for you. So first one is first MCQ. Best study design for rare disease. Rare disease, it is case control. Best study design for rare disease, case control study. Best study design for a rare occupational exposure. Here occupational is coming, so cohort study. Third, study for prevalence or burden of disease. Prevalence and burden of disease. So you have to remember the key points. In first, it is rare disease, so case control study. Then second, rare occupational disease, then it is cohort study. Third keyword is prevalence or burden of the disease, then it is cross sectional study. Prevalence or burden, cross sectional. Third MCQ is done. Fourth, measure of exposure and outcome. Here is keyword is exposure and outcome at a same time point of time. At the same point using primary data. Here data is important. Primary data, it is cross sectional study. Same question with secondary data, then it is ecological study. Measure of exposure and outcome at a same point of a time using secondary data, it is ecological, and primary data, it is cross sectional study. So you have to remember these questions. Then moving forward, eliminates only known confounder in case control study. Known confounders, we have known confounders, then it is matching. Okay, keyword is known confounder. Second is eliminate both known and unknown confounder. Here keyword is known and unknown confounder, then it is randomization. Remember it. Then next question, recall bias, selection bias and Burkensonian bias seen in which study? Case control study. Remember the three bias. Recall bias in case control study, we can't recall the means the subject or case can't recall the past memory or any habit. Selection bias, then Burkensonian bias. These are case control. Then father of evidence based medicine, it is direct question, that is David Sackett. It is a father of evidence based, so evidence based medicine, it is David Sackett. You can remember ed evidence based David Sackett. Then vaccine which follows open vial policy. Open vial policy means you can use a single vaccine for multiple dose. So these are all T series vaccine. T series vaccine means which one? DPT, TT, pentavalent. Okay, these are the Tdap, TT. So these are the T series vaccine. Then hepatitis B and polio vaccine. Both IPV and OPV are follows open vial policy. Then moving forward, the very important question regarding vaccine, the diluents for reconstituted vaccine. First is BCG. Everyone knows BCG for normal saline. Then BCG is normal. So you know at birth the normal vaccine is BCG. So normal saline. Measles, it is distilled. So हम किसके लिए स्टडी कर रहे हैं तो एमडी मिलने के लिए स्टडी कर रहे हैं तो डिस्टिल वाटर एमडी measles distill water. Then Japanese encephalitis, phosphate buffer Japanese encephalitis. Then next is delayed immunization age limits. So till 1 year, which vaccine you can give up to 1 year? BCG, Rota, Penta, IPV, PCV, hepatitis B. So remember this, because they ask the question that in OPD 2-year boy come with no history of immunization, which vaccine you will give? So up till 1 year you give BCG, Rota, Penta, IPV, PCV, hepatitis B. Till 5 year OPV, measles, MR, vitamin A. OPV, measles, rubella, vitamin A. And till 7 year only one vaccine, that is DPT. Pentavalent is given up to 1 year, but DPT is given up to 7 years. After 1 year, if the child comes, you will replace pentavalent with DPT. Then adverse effect of rotavirus, everyone knows, intussusception. It is very important, one liner. Adverse effect of measles, toxic shock syndrome. So moving forward, strain for yellow fever vaccine, yellow fever 17D is strain for yellow fever vaccine. Then strain for measles vaccine, Edmonston Zagreb strain, it is for measles. Then strain for mumps, Jerry Lynn, it is for mumps. For yellow fever 17D, for measles Edmonston Zagreb, for mumps it is Jerry Lynn. And strain for cholera, it is Dukoral. Then moving forward, most heat sensitive vaccine, reconstituted BCG is most heat sensitive. So which one is most freeze sensitive? It is hepatitis B. So most freeze sensitive hepatitis B, most heat sensitive BCG. So hepatitis B never kept in deep freeze. So it is most freeze sensitive vaccine. Most important equipment for cold chain, ILR. Okay, moving forward, it is now, these 4 questions are very important because they are confusing. So remember the keywords. Ability of screening test to differentiate disease from non-disease, or nearness to true actual value. Ability of screening test to differentiate disease from non-disease, disease from non-disease, and nearness to true value. It is validity or accuracy. True value, disease from non-disease, these are the keywords. So validity and accuracy. Then probability of having disease out of those tested positive. From positive tested, probability of disease is positive predictive value. From tested positive, the probability of having actual disease is positive predictive value. Then most useful property for screening test, it is sensitivity. Most useful property for screening test, sensitivity. Then moving forward, diagnostic power of a screening test to correctly exclude the disease. Correctly exclude the disease given by negative predictive value. Correctly exclude the disease. Then statistically best measure of central tendency, it is mean. Best measure of central tendency, mean. Most frequently value occurring any data is mode. Most frequently occurring is mode. And most statistically best measure is mean. Then mean is greater than median, greater than mode. The data is positively skewed. Mean greater than median, greater than mode. Then first standard deviation is 68% of the observations, standard deviation. Then second and third standard deviation 95 and 99 respectively. Then next question, graph to represent frequency of continuous variables. Continuous variables frequency. Frequency is nothing but histogram. Frequency. Histogram. Then graph to represent frequency of discrete variable. For continuous variables it is histogram. For discrete it is bar diagram. Discrete it is bar diagram. For continuous it is histogram. Then joining of midpoint of histogram using straight line is frequency polygon. So you know joining of midpoint of histogram using straight line is frequency polygon. Then father of epidemiology, John Snow. Very important, father of epidemiology, John Snow. Then correlation coefficient calculated in coefficient of correlation calculated in scatter diagram. Then these two are VVIMP questions. So null hypothesis is true but it rejected. Then it is type 1 error. Null hypothesis is true but it is rejected. It is also known as false positive trial. Type 1 error, null hypothesis is true but it is rejected. Second, null hypothesis false but it accepted. It is type 2 error and it is false negative trial. False positive trial, false negative trial, type 1 error, type 2 error, type 1 null hypothesis true but rejected, type 2 null hypothesis false but accepted. Moving forward, then non-parametric test to compare qualitative data between two or more than two groups. Chi-square test. Two or more than two groups, it is chi-square test qualitative data. Qualitative data, it is chi-square. If quantitative data, then we have to compare mean and standard deviation in a single group or in a two groups. If quantitative data, mean and standard deviation in a single group, it is paired. Single group, it is paired, and in two different groups it is unpaired. If qualitative data is given, there is no mean and standard deviation comparison, directly chi-square test for qualitative data. In quantitative data, we have to calculate mean and standard deviation. In a single group, it is pair t-test. In a two groups, unpaired t-test. Remember, major disinfecting property of chlorine is due to HOCl. HOCl. Straightforward question. Then these are the very important questions. Level of residual chlorine in outbreak or post disaster, it is 0.7 to 0.9 mg per liter 1 hour of contact period. 0.7 to 0.9 in outbreaks post disaster, that is epidemic. Then level of residual chlorine in swimming pool more than 1 mg per liter 1 hour of contact period. Okay, in swimming pool 1 mg per liter, for outbreak 0.7 to 0.9. Test which measures both free and combined residual chlorine, OTA, orthotoluidine acetate test. Okay. Then most reliable and efficient indicator for fecal contamination of water. Reliable and efficient, E. coli. For fecal contamination, E. coli. Then water washed and waterborne diseases. Water washed diseases are scabies and trachoma. Scabies and trachoma are the water washed disease, and waterborne are typhoid and cholera. Typhoid, cholera are waterborne, and water washed disease scabies and trachoma. Most important air pollution indicator, SO2. Most important is SO2, but commonly used is CO. Commonly used is CO, but most important is SO2. Remember. And brightness or power of light source measure in candle. Okay. So these are the 51 liners of PSM. Remaining 50 we will discuss in second part.